All right. Hi, happy Thursday. Thursday.
Yeah, Thursday. I almost said no. We always do these on Wednesday.
Yeah.
I'm like, it's Wednesday. Hello, everybody. Welcome back to our little.
We gotta come up with a catchy name.
Yeah, we do need to come up with a catchy name. I've had to come up with
too many
names.
We're not super great at names.
Yeah, well, eventually. But Dr. Ashley DeBoer of Rise Chiropractic
and Dr. Krystyna Holland of Inclusive Care.
Yes, in case you haven't tuned in before, we'll introduce ourselves every single time because that's just polite, right? I guess. So today we thought this video is going to be, I think, kind of short because what we're talking about, well, it is super important. It's like pretty much, like you get to the point and this is how you can help yourself. I guess. I don't know. That's not what I'm trying to think or say.
Mostly
one of those days today.
Mostly it was, we picked a bunch of articles and this is the one that we picked for today. So the article itself was really short. It was from today.com and it was called Stay-at-Home Mom Depression. We'll put the link if we remember, which is, as we all know, a little bit touch and go, but we'll probably put the information somewhere in the video comments.
I don't think I have on any of them. I will do that today when we're done, I promise. But yeah, it was, super short article, but a really great topic because so many people don't talk about it, right? Like we talk about, I'm sorry, did you say what we're talking about?
Stay-at-home mom depression.
Yeah. Okay. I was like, did you introduce that? But we talk a lot about postpartum depression, period, right? But that's usually like very, not super new, but a few weeks old, maybe a couple months old or whatnot. But this article definitely talked about stay-at-home moms and just the isolation they feel and everything like that. So we thought we'd just talk about it a little bit and how we can help you, and stuff like that to get out of your isolation and kind of, get out of the house. I think that was really the thing, right? Is that they feel stuck in the house a lot, even though I did love all of the above. When the article was talking about how like people will say like, but you're so blessed to get to stay at home and raise your kids and you have all this time and everything like that. So
hashtag shit people say.
Yeah, right. And you should just go like this. But, it is really hard because even though I'm not a full-time stay-at-home mom, so but I still sometimes feel the isolation because of what I do, and I am one-woman band. I'm lucky to have other women surround me, but I don't see them every day. Right. And 90% of the time, my son is still here at work with me, so I don't get a break, right? But he's going to kindergarten full-time in the fall. I'm excited about that. But it's just this time in a woman's life where you're still craving community, but your community becomes your kids, and you want more than that, right?
Yeah.
Yeah.
And I think that there's something to be said about that in healthcare too, because I think that once during pregnancy, you have all these appointments and all these providers are asking, how are you doing? How are you feeling? And then the baby comes out and it's like, okay, well, you have a baby. How's the baby doing? Like, what's the baby?
It shifts, right?
Yeah. And like, that's great. You should definitely have a provider ask about your baby, but also you need a provider who asks about you and is worried about how you're sleeping and if you're eating and how you're feeling and like, are you crying throughout the night?
Right. Yeah. Especially if it's not your pediatrician, right? It's like, I think we all catch ourselves, right? When mommy comes in with baby, I'm sorry, babies are cute, but it is very important to, how are you doing, mommy? Or at least more than just what's up with the baby, right? And the other thing too is that what the article kind of touches on is that people just don't understand sometimes what it means to be a stay-at-home mom, totally. And it's not that you're sitting around while the kids are running around and you're watching TV. Come on, like even if you work full-time, when you're with your kid, that's not how it is, right? And so it's just having this opportunities and time for mom to get out and whether that's by herself or go with her friends or find a mom's group or something, or go to not the park. I was gonna say go to the park by yourself. That might be kind of weird, but just get out in nature. Maybe that would be better. A hike for yourself, right?
Hike, mountains.
Yes. Yeah, because a lot of stay-at-home moms once were in the working world, right? So you had that like time to get out of the house, to communicate with adults. That was the other big thing too, right?
Absolutely.
And so just to be able to have that is really important, you know, and everything like that. So to find your little group of moms can sometimes be really hard too. So
yeah, well, and now you want someone who can be your friend and also their kids can be friends, and it gets complicated. And I don't think either of us have like great, like, well, if you just do these 5 things, you'll have mom friends and baby friends and all the friends.
No.
But we recognize that it can be problematic and it can be challenging, and we're here if you ever want to talk about that. This is a very like no judgment zone for sure.
Yes.
If you need to talk about how you need a break from your kids, that is a-okay. That is completely normal. You are not a bad mom for wanting that or needing that. Like that is good for you for recognizing it. And what you know, we can try and help you find a way to problem solve getting that.
Yeah. I always think it's funny, cute when my moms will be like, "Can I bring my kids?" And the office is super kid friendly. And I said, "You absolutely can. And you absolutely don't have to," you know, just to have the, you know, the 10-minute drive here, the 15-minute appointment or whatever hour appointment, and then the drive home by yourself is okay too. Yeah. But what I found being a mom is just, it is really hard in general to just put yourself out there and be like, "Hi, do you want to be my friend?" Mm-hmm. You know, like Dr. Krystyna said, it's like, not only do you feel like you got to gel with the other person, but your kids got to gel, and that doesn't always happen. Mm-hmm. And so I know that can be really hard. We do have some great opportunities though in our office and also on the floor that we are in of just groups where you can come and meet other mommies, super informal. Some of them are workout classes. We have I don't want to say mommy and me, but Leslie has a Mama Fit class where you can bring your kids if you have to, if you have childcare issues. So cool. She has a prenatal class so you can get to know mommies that are gonna have babies around the same time. I have all my birth fit classes, prenatal and postpartum. Again, those you can bring your baby, but you don't have to. But that's always a great way to meet people. And then I'm trying to think what else we have.
Some like feeding group. Is there a feeding group?
Yeah, Emily and Natalie, I believe, the IBCLC. Mm-hmm. Don't quote me on that. I'm pretty sure it's Natalie. They have it's twice a month. You can check out Emily's Facebook page, Conscious Living, if you want to get exact dates. But she does, check baby for anything, you know, how are you feeling? Cranial sacral and an IBCLC, so you can do some body work too.
We also have a postpartum doula on the floor. If you can't tell, we're sort of obsessed with people on our floor, so that's really fun for us.
Baby wearing yoga, that's the other one. Yeah, Emily is starting baby wearing yoga, so that it's always nice to be able to bring your little one if you need to, because I don't want to say excuse because it's not an excuse, but a lot of times we'll say I can't do that, I don't have childcare, or whatnot. But
totally understandable,
right? And that's okay too. Sometimes you just don't want to venture out, but you can almost to all of our activities. You can bring non-mobile babies, and some of them your toddlers too. Mind you, it might be crazy though. Yeah. Also, the second Tuesday of every month, we host Mommy's Meetup. It is, I'd say, geared to not super new mommies because there are a lot of like toddlers and even like my 4.5-year-old, and they run crazy. Mm-hmm. But it really is, you come, kids can go crazy, get into things, have fun. We can still talk and chat, and you don't have to worry about like they're leaving a mess or they're getting into this or anything like that. Yeah. You know? And
if any of that sounds interesting to you, or those people sound interesting, or just maybe other mom sounds interesting, we're actually having an event on May 4th.
Yes, a little over a week away.
May the 4th be with you. That's what it is. And it's called Womb.
Yep, the Womb Birth and Baby Fair.
And we'll link that too as soon as we remember.
Yes, that one we absolutely will. There are limited seats because it is speaker heavy or speaker based. So there are over 10 speakers talking on everything from home birth, pregnancy, to postpartum, to how to keep your kids healthy. We'll link the Facebook page because you can buy tickets from there. Mm-hmm. And you can also look at the speaker lineup. It is an all-day event. You do not need to stay the whole day. You do not need to stay the whole day. You can come and go as you please. There'll be a nice long gap for lunch. So if you want to venture out and come back, you can totally do that. And not to mention, there's like literally over $1,500 in raffle prizes.
Yeah, there's a ton.
Yes, and because we're keeping the amount of people that we're going to have for this event kind of small because of space restrictions, you have a pretty darn good chance of winning some awesome things.
That's true.
Yeah, so tickets are just $20 if you and your partner or you find a mommy friend. Well, she's not a mommy friend, but she can be my pretend mommy friend. She could just be my friend, right? You can get a couple discounts where you get $5 off, so it's just $35 for the 2 tickets.
Sweet.
Email me. It's all on the Facebook page if you need the code. But otherwise, basically what we're trying to say is if you're a stay-at-home mom, not a stay-at-home mom, you're looking for community, you're feeling isolated, you can definitely reach out to either of us. We can guide you. We can help find moms group in your local areas, you know, if this is too far to come, but just somebody else to talk to and a place to go where you don't feel like you have to really try to get somebody to be your friend, right? Because that's another thing with anybody, I would think. It's just, you know, friends should just gel and mesh is how it should work, right?
Totally.
All right. Anything else?
No. Have a terrific Thursday.
Yeah. Bye, guys.
Bye.
See you next Saturday. I don't think you could hear it. It wasn't that loud.